to a series of special podcasts for the BAME Health Collaborative. Today's special guest is Professor Rotimi Jaiyesimi. Professor Jaiyesimi is a trustee for the BAME Health Collaborative. He is the Associate Medical Director for Patient Safety and a consultant in obstetrics and gynecology at Basildon University Hospital. He is also the Chief Executive Officer of Trojan Medical Group, which is a health infrastructure group. A very warm welcome to you, Professor Jaiyesimi.
Hello, good evening. Thanks for having me.
Lovely to see you. It's wonderful to see you. You are somebody who has so many accolades to your name. It was actually very difficult to pick out which ones I was going to mention in the introduction to you. But I suppose one of the first questions I'd really like to ask you is about your personal journey. So it's really a quick question about why medicine, how did you get into it, and was it always your passion?
Yes, medicine has always been my passion. And I think how that came about was the very fact that my mother was a nursing sister. And I used to go to the hospital to see her. And I think I got fascinated by what took place in the hospital. And then I, in my high school, went to more of a science-based high school where you did sciences, which really excluded me doing anything arty. And the natural progression from that was to go into the sciences. I had an interest in veterinary medicine as well. And I think when I look at both of them, it's part of the caring profession. And I think I had no difficulty in deciding I wanted to do or to become a doctor. And that's how I got into medicine. And I haven't regretted it.
And how easy was that journey for you?
Oh, studying, it's not been a very easy journey. I graduated in 1978 from the University of Ibadan in Nigeria. Medicine is a 5-year course. After that, you have to take a 1-year internship. And when you start your postgraduate studies, that could take about 7 years. So I started my postgraduate studies in 1980 and finished it in 1993, 94. So it's a long journey of hard work, but rewardable in that you are helping people.
There are a huge number of titles to your name, and the people that know you will say things about you, such as you are not only highly qualified in your field, but you contribute towards a number of very specific documents and studies. And your contribution has been absolutely enormous to the health service. And people say about you that you're a motivational speaker, you've won many awards, and you're described as an asset to the UK National Health Service. So how does that make you feel when you hear all these amazing, wonderful comments about yourself?
Well, it's quite humbling. What I set out to do was to at least fulfill my ambition, to act as a role model for people coming. So I usually strive to better myself. And I think that's how things have unfolded over the years. Going into medicine, going into medical law, and going into different aspects. What I have tried not to do is to box myself into one sector. And that's why you've introduced me the way you have. But it is a very humbling experience. And I think it serves as an inspiration for other people, because other people have try to emulate what I have done.
I mean, it's fantastic everything you've done, and we're very grateful to you for everything, all your services to the health service. You heard about the BAME Health Collaborative. I mean, how long ago would that be that you sort of got involved?
I got involved at the inception. The founder and chief executive, Michaelene, is a friend of mine and a professional colleague as well. And she invited me, she told me about it, and we discussed it, and it was a very good concept. And that's how I got involved.
Mhm.
I was sold into it. I was happy to be part of it.
It's a wonderful thing that you're doing. And what do you think your contribution is going to be to the BAME Health Collaborative?
Well, having gone through the journey, I came to the British Isles in 1985 as a relatively junior doctor. I was a registrar, so a trainee doctor. So going through the journey, starting from Dublin to London, and from London to Plymouth, and eventually to Newcastle, exposed me to the different aspects of what medicine is about, the different intrigues, the pains, the gains, the happiness, the good times. And I think having walked through this journey, it gives me the empathy. I can understand what's going on. I mean, in my early days, it was very difficult to find many colored people even becoming consultants. I was one of the first African to be appointed consultants in obstetrics and gynecology, and that was in 1994. And it wasn't easy, and I know it had to do with your place of origin, your skin color, but I've been able to navigate that using different skills, and that's what I intend to bring to the BAME Health Collaborative.
Mm-hmm. Which is absolutely wonderful, to bring all that skill and talent to the table, as it were. But where do you see the BAME Health Collaborative sitting? What do you see it as its role in society?
It has multiple roles to play. First of all, if we look at those who use the services, patients, COVID-19 has exposed a lot about the social indeterminate or determinants of health, the disparity, poverty, poor housing, poor education, poor access to health. BAME Health Collaborative will be reaching out to the public to raise awareness about well-being, wellness, mental health, and other issues, encouraging people to present early when they are unwell. That's looking at it from the public sector or service user. But as professionals as well, there is no doubt that there is some discrimination that goes on within the workforce. And this has to be redressed, it has to be addressed. And this is where BAME Health Collaborative comes into our being, because it's to signpost people, it's to build people, to build a network of BAME healthcare professionals, and to signpost them. There shouldn't be any disparity from shop floor to the board level. So we aim to look at those things in different fronts. And there is more to the BAME Health Collaborative. It's not just about service provision, it's not just about the public, but we also want to look into why some diseases are common in Black people. Research is not carried out. We don't know why more Black people have fibroids, why they have more keloids, or why they have more severe prostate cancer. So we do hope that as we grow as an organization, we'll be in a position to undertake research. One of the interesting things that has happened positively recently is the collaboration that we're going to have with NICE. That's it used to be called the National Institute for Clinical Excellence. They have engaged with us, and we will be looking to contribute to clinical matters.
So I think we're going to be going to a short break, and we'll be right back afterwards to look at what you believe are the top priorities for the BAME Health Collaborative. Welcome back after that very short break. We were just talking to Professor Jaiyesimi, and we were talking about some of the priorities within the health service. You mentioned a huge number of conditions that this particular organisation will be able to help us to look at in more detail and understand why they affect BAME communities in particular. So looking at some of the things that you've already mentioned, what would you suggest were the top priorities for the BAME Health Collaborative?
If we're looking at disease process, one of the topmost problems in the community is obesity, and that is related to lifestyle, access to gain, affordability. That's looking at lifestyle changes. Hypertension and diabetes are also common problems within the BAME community, and again, we will be hoping to address that. Then when it comes to chronic diseases such as malignancy, breast cancer, for example, in women and also in men, are aggressive in Black people. We don't know why, but what we hope to do, one, is to encourage early diagnosis, um, and also make sure that Black people receive the best treatment.
One of the issues, you've just touched it very briefly there, we talked about things like breast cancer, which is also prevalent not just in women, but also in men. And I think some of the issues here that might be a cultural thing where men really don't want to go and sit in a breast clinic. I mean, is this something that BAME Health Collaborative can help with in educating people?
Definitely, the BAME Health Collaborative will do that. That's what we intend to do. But you see, we talk about same-sex work in the hospital. Yes, if we're going to have a breast clinic for patients, then one has got to ensure you may provide services for men's clinics and services for women's clinics, so that you don't bring in that shyness, because men will feel uncomfortable at sitting in a woman's clinic because people will be wondering why they are there. Very few people know that men can have or develop breast cancer. So I think that's one of the things we will advocate for. And the other malignancy that is very common in Black people is prostate cancer in men. The type is different, it's more aggressive, the outcome is also deadly. More Black people die from prostate cancer than Caucasians. Perhaps it's the type, again, research hasn't been done into that. But I am aware that people are now standing up to put funds into research to find out whether there's some genetic basis in it.
Yes, thank you for that. I'm just going to apologise to anybody watching or listening right now. We have a few technical problems, so we're not able to hear Professor Jaiyesimi as clearly as we would like to. Professor, I wonder if you would be able to pull out your headphones and try and push them back in again, please. That might help with the communication that we have. So from the actual device. That sounds as if it might have helped us enormously there. This thing called modern technology. No, we can't hear you. We can't hear you at all at the moment. I think we should take a break while we try and sort out our technical difficulties. Yeah, if we could play one of the videos again, that would be great.